Okay, we're with National Group Marketing, and we're going to go over our health and income protection plans. First, what I'd like to do is introduce ourselves. This is Doug Chapman, President and CEO of National Group Marketing, and myself, Rick Thornton, Business Development, National Group Marketing. And what we will cover in this video, we're going to go over what we're going to cover. What is the value to the client when using this plan? What is the value to the agent when marketing this plan? And Doug is going to talk a little bit about his personal experiences with the product a little bit later on. Now, what are the benefits to the client? First, the policy is a very high-end indemnity plan that can be used for both catastrophic events and doctor's office visits. We have double and triple indemnities built in. This will give backup protection to your clients. And this plan can be sold year-round as a group plan or as an individual policy. And the price is 1/2 the cost of a major medical. Unveiling the curtain here. What are the intangible benefits to the agent? Able to give clients an option to their major medical plans that's affordable. Able to reduce the client's total cost of coverage, thereby increasing the additional amount they can spend or save. This product will open a flood of referrals from the clients to their friends, and the agent will be paid handsomely for his or her efforts. Now, what are the policy benefits with this policy here? Now, what we've done, we've taken a 58-year-old male, a 56-year-old female non-smoker, and zip code 75067, which is a suburb of Dallas, Texas, and we compared premiums. We have a POLIC premium here. POLIC stands for Philadelphia American Life Insurance Company. With that premium is $785.67. Compared to the Major Med premium, a very popular Major Med, all of you have heard of it. The premium here on the Bronze plan is $1,218. Network, we'll be using a PPO network, where this Major Med over here is using an HMO network. Deductibles. Now, we have a $7,500 deductible that's not really a $7,500 deductible, and you'll see later in the notes what it actually is, whereas this Major Med has a $7,400 deductible. Doctor's office visits, we have a $160 benefit for doctor's office visits, where this Major Med has a copay of $50. Out-of-pocket maximum, the way the plan is set up, we don't really have a traditional out-of-pocket maximum, and we'll go over that shortly. However, with this Major Med, the out-of-pocket maximum is $81.50. Last but not least, I know everyone is interested in commissions. We have a 9-month advance commission. You have the option of getting as earned, 3 months, 6 months, or 9-month advances. With this premium that you see here, $785, we have an advance of $28.28 on that premium. Whereas with this Major Med, it's as earned at $60.90. And here's some of the notes. Now, note, when we're talking about this deductible up here of $7,500, patient will not pay deductible for outpatient procedures performed under general anesthesia. So for outpatient procedures, there is no deductible. Also, there is a $3,000 first day admittance benefit. Basically, what we're talking about, if you include the first day admittance benefits of $3,000, we're talking about a $4,500 deductible. This is based on the preferred plan or 3 units. Again, let me emphasize this commission a little bit more. We have $2,828.41, which is a 9-month blended advance. The as earned on this is $235.70, which comes months 10 through 12 if you're getting the advance. Now, let's recap the benefits of this policy. Again, we've got a $785 premium versus a $1,218 Major Med premium. Now, what's in it for the client? Premiums are 45% less than the major med. $7,500 deductibles applied for inpatient stays only with a $3,000 admittance benefit. $160 benefit for doctor's office visits, giving you 20 of those per year. We have an additional $50,000 of critical illness, which is actually a separate policy. However, it is part of the same premium. We have a $4,000 per incident of accident coverage, which is a separate policy and can be sold separately, but it is part of the overall premium that you saw. So they get one premium, but they may get up to 2 or 3 or 4 policies. We have a $1,500 per year dental insurance policy with a vision discount. We have a $1 million specified disease policy. Now, that specified disease policy, just to let you know, was not included in the premium up here. If you wanted to add that specified disease policy into that premium, is about $96 more. Pays the first $800 for an emergency room. We have a large national PPO network. The plan increases annually only based on age. And the plan pays multiples of the RV, RBS, or the Medicare physician's fee schedules to doctors, in addition to daily room payments of $7,500 a day for ICU. Now, this $7,500 a day is a little bit on the high end for the premium. This is for the ICU. If you're typically in the hospital and you're not ICU, for sickness, it's $4,500 per day. So what's in it for the agent? Very easy to sell. Quick and easy application, 9-month advanced quadruple digit blended commissions. Payday is every Tuesday and Thursday. Quarterly and persistency bonuses. Free verified leads to targeted business owners based on production. You can recruit agents and grow your agency, and company trips based on 18-month production results. That's right, folks. When you hit your number, everyone goes. Now, who should get this plan? Good candidates are, and keep in mind now, if you're doing a group, it is guarantee issue. So if you're not doing a group, good candidates will be healthy individuals, people on COBRA, self-employed folks, people between jobs, people with out-of-control premiums, people who are in need of a PPO because their doctor won't accept their HMO, and people in need of a lower deductible. Poor candidates, women needing maternity, and you tell them that up front before you even start the conversation. People receiving a subsidy and cost sharing. Usually, if they're receiving a cost sharing, a lot of times it's going to be a lot less expensive than this product, maybe like $50 a month. People with systemic pre-existing conditions, and people on costly meds. Now, Doug is going to speak a little bit about the opportunity, and one of the things Doug wanted me to remind everybody, by helping more people get what they want, you'll get what you want. Take it away, Doug. We have here Doug Chapman, President and CEO of National Group Marketing. Doug, can you tell us a little bit about yourself?
Yeah, Rick, thank you. I've been in the health insurance business, major medical, individual primarily, for over 35 years, hired and trained thousands of agents and worked with virtually every major medical carrier in the country. And in 2011, even before then, we noticed this trend of these traditional major medical policies continuously going up 10, 20, 30% per year, while deductibles were getting larger, which means benefits are coming down. So paying more every year for less benefits with no change in sight. And when 2011 came out in the ACA, they cut everybody's commissions. We were forced with that and the decrease in value of these policies to look at a different business model. And that's when this policy came out. So we've been selling for 10 years.
Doug, what was your success with this product?
We've made, frankly, in my 35 years, in the last certainly 8 to 10 years, made more money I've ever made in my life, and our agents have too. We lost a lot of agents with the ACA because you couldn't make a living. Those agents are coming back and building new homes and making six-figure incomes, some of them seven-figure incomes with this product because of the great value, the great commissions, the great rate stability, and more importantly, the value to the client. They're building clients and making great money doing it.
You have mentioned the value proposition several times. What is it that you believe to be the value proposition here?
Here's the concept. These consumers do not need to be paying tens of thousands of dollars a year in premiums and deductibles and co-insurance and co-pays and admission charges to have quality health care. What they need is quality health care and a means to fund it. Well, with our products, it's called a health and income protection package, a package of products what pays all of their healthcare needs, surgeries, doctor visits, labs, x-rays, chemotherapy, you name it. But we have no deductible for 95% of our claims. Unless you're hospitalized, there is no deductible. Everything is first dollar. The premiums are half the cost of your lowest major medical policies. So when you cut the premiums in half, put that money back in the consumer's checking account, when you eliminate the deductible and co-insurance from 95% of the consumer's medical bills, that consumer has a $20,000 head start before they ever go to the first doctor visit. And obviously we pay doctor visits first dollar. They need rate stability, which we do. The average rate increase is less than 3% a year. And the products are outstanding, much better than any traditional major medical.
Okay, Doug, if the hospital charges less or if the doctor's office charges less than what the plan pays, can you give us a little scenario of how that works?
Yeah, Rick, great question. This is a defined benefit plan. It is a high-end defined benefit plan. It pays a certain defined amount for any medical procedure you possibly have. And we have double and triple indemnity benefits, and many times the consumer actually gets an overpayment. That's called an excess indemnity. So this is a consumer-driven product. It's a very different business model than your traditional major medicals. The major medicals, the consumer does not care or know what anything costs because they have a deductible and co-insurance to meet. They get penalized if they go out of network, so they're controlled by the major medical carriers on where they go. They always have to meet their deductible and co-insurance first for the majority of their claims. With our product, it's a consumer-driven product. We make the consumer intelligent, give them the PHCS network discounts they get instead of the major medical carriers. So as long as our consumers shop just like they do everything else in their life, which we help them shop for good rate, good benefits, their plan many times pays far more than the actual bill is. So if you go to a doctor visit that's traditionally $120, we pay $160 for a doctor visit with no copay.
And the difference goes back to the
exactly.
client.
Now, if that consumer stays in network, that $120 doctor visit will be repriced down to between $60 and $70. They receive that discount at the point of service, which means they will get $100 in that scenario excess indemnity. The $60 or $70 will be sent
right.
to
Now, they're not actually making money off the product.
They're not making money off the product. They can't do that, but they can receive the excess indemnity if they become wise
because
shoppers.
that's a contractual amount
that is the
has
contract
to go out.
amount.
Right.
We will only send the PPO discount on contract to the doctor if it's $70. If it drops from $120 to $70 and we pay $160, we'll send the $70 electronically to the physician, and the consumer will receive whatever excess indemnity the contract pays.
Right. Now, you've got an example of that, and I'm putting an example on the screen right now to give you some idea. Doug, can you tell us a little bit about this example we have on the screen now?
Yeah, I had a shoulder surgery, severe shoulder injury in Lake Tahoe, Nevada on a snow ski trip, and came back and ended up having complete reconstructive surgery on my shoulder. Went here down the street here at a brand new state-of-the-art surgery center. My surgeon was nationally known surgeon for shoulders. He was with the New England Patriots for 15 years. I went to a PPO network provider, which is a state-of-the-art surgery center here in Dallas called Star Medical. And when I went in there and had my outpatient surgery done, it was repriced, as you can see, from I think it's $11,900 it was repriced to $4,100. That's how huge the discounts are by owning your own PPO network, which we provide for the consumers. So when I went to this PPO network, my deductible was waived. I have no deductible since it's an outpatient surgery, and the plan was repriced, and my indemnity paid $6,700 more that I received a check on my excess indemnity, which $6,700 actually more than the hospital charge.
On that one particular accident, what was the total you made? Because there's some more checks you received.
Yeah, I had the accident policy in addition to this, which was another $4,000. And I stayed in network on my MRI, and I picked up another $150 in excess indemnity on my MRI. So on this surgery with a traditional major medical policy, where I would have been out $9,000 to $10,000
in deductible costs,
in deductible and co-insurance,
right.
And the major medical would have got the repricing, not me as the consumer. We turned that around. I'm the consumer. I got the repricing, not the insurance carrier. So it's a consumer driven, teaches the consumer how to shop, and the consumer can be benefited by the excess indemnity.
Okay, Doug, tell us a little bit about some of the agents who are selling this product and how they're doing.
It's real exciting, Rick. When the ACA came out and they cut everybody's commissions by 60, 70%, there are hundreds of thousands of agents left the industry. Some of them stayed behind to sell the ACA, but I met several of those guys that were selling the ACA, making $18,000 to $20,000 a year, struggling with the major medical. When I took them over and they came on this plan and got their head wrapped around this different business model, then these guys are making six-figure incomes easy within a year to 2 years. And obviously the rate stability at less than 3% a year increase, they've grown their account significantly by several hundred clients a year. And the average shelf life of this product's generally 7, 8, 9 years, so residuals really add up. And the clients are very happy. They don't have deductibles to deal with, and the great value.
Right. So what you're saying is the agents are doing pretty well now.
Agents are doing very well, building new homes, sending the kids through college. The careers are exploding because this is a business model that's working, great value to the consumer, and a great opportunity for the agent.
Okay, Doug, is it anything else you want to comment on?
Well, just this, it's just a great income opportunity, but more importantly, it's a movement across America where we're changing lives with this healthcare product.
And we're helping a lot of people.
We're helping an awful lot of people. Yeah. So we're making a lot of money, no question about it. But we're helping a lot of people. It doesn't get any better than that. Helping people, saving folks money, making them good money at the same time.
Thanks, Doug. If you're interested in getting contracted, you will see a contract link at the very end of this video. You'll also see an email from us that will have agent testimonials and a little bit more about the product. You should get this plan. Good candidates are, and keep in mind now, if you're doing a group, it is guaranteed issue. So if you're not doing a group, good candidates would be healthy individuals, people on COBRA, self-employed folks, people between jobs, people with out-of-control premiums, people who are in need of a PPO because their doctor won't accept their HMO, and people in need of a lower deductible. Poor candidates, women needing maternity, and you tell them that up front before you even start the conversation. People receiving a subsidy and cost sharing. Usually, if they're receiving a cost sharing, a lot of times it's going to be a lot less expensive than this product, maybe like $50 a month. People with systemic pre-existing conditions, and people on costly meds. Now, Doug is going to speak a little bit about the opportunity, and one of the things Doug wanted me to remind everybody, by helping more people get what they want, you'll get what you want. Take it away, Doug.